So friends, welcome back to my YouTube channel and on different lectures on veterinary obstetrics. And in our today's lecture, we discuss something about the genital prolapse in the domestic and pet animals. I am Professor Govind Narayan Purohit, the head department of veterinary gynecology and obstetrics, College of Veterinary and Animal Sciences, Rajasthan University of Veterinary and Animal Sciences, Bikaner, Rajasthan, India. So friends, genital prolapse means distal displacement and eversion of the pelvic genital organs such as vagina, cervix or uterus as a protrusion through the external genitals, the vulva or the vulvar lips. It's also known as the distal displacement. The vaginal prolapse can occur during gestation, the postpartum period, sometimes in non-pregnant animals, and rarely during estrus in cattle, buffalo, and sheep. Uterine prolapse occurs during the postpartum period only, but rarely it can occur at other times also. So we first discuss something about the cervicovaginal prolapse, the protrusion of the cervix and the vagina through the vulvar lips, and basically the prolapse occurs because of incompetence of the constrictor vestibuli muscle and the vulvar muscles, and is also known as casting of withers. It's common in buffaloes, cattle, sheep, and boxer breed of dogs during estrus. It's common in pluriparous cows and in Hereford, Santa Gertrudis, and the Rathi breed of cattle. Classically, the prolapse has been classified into the 4 degrees. In the first degree, the vagina protrudes only when the animal sits, and it disappears when the animal stands, as is shown in the picture here. In the second degree of prolapse, the vagina is constantly prolapsed and there is tenesmus. In the third degree of prolapse, the vagina and cervix are exposed and pregnant cows may sometimes abort. In the fourth degree, there is necrosis of vagina and the cervix is the severest form of the prolapse. The etiology continues to be poorly known. However, high estrogenic feeds during gestation, perivaginal fat deposition, rising levels of estrogen during the last trimester, vaginal or vulvar injury, poor conformation, cold weather, increased intra-abdominal pressure due to high bulky diet and pregnancy, the constant persistence of ovarian cysts, hormone therapy are considered to be the etiologic factors. Prolapse in young brachycephalic dogs and prolapse of vagina at the time of estrus is fairly common. The consequences of the outward projection of the genital organ are edema, inflammation, and because it puts pressure on the urinary meatus and the urethra, there is difficulty in the urination. There may be infection and constant straining, or what we call the tenesmus. The diagnosis of prolapse is fairly easy. A ugly mass may be soiled, is visible through the eyes, and it sometimes tumors of the vulva, vagina, cervix may confuse with a vaginal prolapse, and the prolapse of the bladder must be differentiated. The therapy of prolapse is simple. It must the part that is soiled with water, dirt, and dust must be washed with cold water and soap. Sometimes one can use alcohol or sugar to reduce the edema. It should be washed with antiseptics. The prolapse part must be raised to relieve the pressure so that the animal urinates, and this facilitates the passage of or the replacement of the prolapse. Then epidural anesthesia, 2 to 4 ml of 2% xylocaine or lidocaine can be used if straining is constant and is more pronounced. The prolapse part is then inverted and replaced back in a standing animal after lubrication. One can use a bottle for replacing, and sometimes when the prolapse is very extensive and the animal is straining is unable to stand, then raising of the lower end and lowering of the forend may help in replacement of the prolapse, because then the abdominal pressure would be less. A vulvar truss can be applied in cows, and then retainers can be used in sheep. The tenesmus or the constant straining can be reduced by injections of sequel, or maybe one can supplement antibiotics, calcium preparations, and antihistaminics. Sometimes to reduce the edema, one may also advocate the non-steroidal anti-inflammatory drugs. Then there are certain regional anesthetic techniques to reduce the straining, because a cow with prolapse will have constant straining, and when the animal is having straining, the prolapse may reoccur. The approaches for anesthetic techniques include caudal epidural anesthesia, 0.5 to 1 ml per 220 kg body weight will provide regional anesthesia for 2 to 3 hours. Aseptically, the skin dorsal to the sacrum is prepared, and dorsal to the sacrum and first coccygeal vertebra is prepared. The fifth sacral nerve at the caudal border of the sacrum in the sacrococcygeal space is prepared, and 1.1 to 1.5 centimeter dorsal to the midline. The 18 gauge 7.5 centimeter needle is inserted into the foramen, and 10 ml of 2% lidocaine is injected at each side. The procedure can be performed bilaterally, and for prolonged anesthesia, 2 to 3 ml of 70 to 95% isopropyl alcohol can be injected at each side. This procedure avoids loss of tail tone and sciatic nerve paralysis. Then sacral paravertebral anesthesia can be performed. The area dorsal to the sacrum and first coccygeal vertebra is prepared. The fifth sacral nerve is blocked by injecting 2% lidocaine at the caudal border of the sacrum in the sacrococcygeal space, 1 to 1.5 centimeter from the dorsal midline. The third and fourth sacral nerves are blocked by injecting in the dorsal foramen. Here you can see in these pictures how the site is prepared and where the needles are placed, and this is where these are the dorsal foramina of the third and fourth sacral vertebra. Then pudendal nerve block can be performed. The ischiorectal fossa on both sides, you can see in this picture the ischiorectal fossa is prepared aseptically, the internal pudendal artery is palpated in the lesser ischiatic foramen is palpated transrectally. The internal pudendal nerve is 1.5 centimeter dorsal to the internal pudendal artery. Here you can see this is the internal pudendal artery and this is the internal pudendal nerve. A spinal needle is passed through the ischiorectal fossa and advanced medial to the sacrotuberous ligament to the area of internal pudendal nerve, and then the local anesthetic is injected here. Continuous caudal epidural anesthesia, alcohol epidural anesthesia using 3 to 4 ml of 95% ethyl alcohol or 4 to 6 ml of 70% of isopropyl alcohol is sufficient for a 400 kg cow. Desensitization results from demyelination of nervous tissue with subsequent loss of sensation in the perineum and tail. And however, accidental overdosage can result into limb paralysis and permanent tail paralysis. Regeneration of the nervous tissue may take 2 to 3 months. So this should be performed only the continuous caudal epidural anesthesia using alcohol should be performed only in animals which are of low value. Then retention sutures have been suggested, including the purse string, the Buhner suture, the button suture, the vertical mattress suture, interrupted horizontal mattress suture, and the bootlace sutures. The surgical management of the prolapse includes the Whipple's operation and the reefing operation, in which submucous resection is done and the prolapse is replaced so that at that part the adhesions develop and the organ does not prolapse again and again. Then a Caslick operation is suggested only in the first degree of the prolapse. Two operative procedures have been described for cattle. One is cervicopexy, which is also known as the Winkler operation, in which the cervix is fixed to the prepubic tendon through the vagina or the abdomen. And then there is a vaginopexy, or which is also known as the modified Minchev method, in which the vagina is fixed with the hip by passing a specialized needle from the vagina to the hip. So these are the three types of sutures commonly used for retaining vaginal prolapse: the purse string suture, then this is the bootlace suture, and this is the horizontal mattress suture. Here you can see this cow is having the prolapse of the vagina. Then in this picture you can see a prolapse retainer is applied in a sheep, and this is how the truss can be applied in a buffalo or in a cow. The truss may be tied here so that it does not slip, and a truss is applied on the outer vulvar lips so that the prolapsed organ cannot come out. In these pictures you can see a prolapse of vagina in a camel, in a sow, and in a buffalo. Then again this is a prolapse in a sow, vaginal prolapse, and this is how epidural anesthesia can be placed in a cow to avoid the straining during prolapse replacement. This is the cervicopexy procedure, fixation of the cervix to the prepubic tendon through the vagina or the abdomen. This is a serpentine needle which is used, and the cervix is tied down the prepubic tendon. This is the prepubic tendon, and this results into formation of adhesions of the cervix with the prepubic tendon, preventing the prolapse to reoccur. And this is cervicopexy through left flank laparotomy. A suture through the ventral part is fixed and manipulated by assistant holding long handled uterine forceps in the vagina, point of through which the prepubic tendon is passed, pubis and ventral part of the pelvis. Then this is how one can suture the prepubic tendon and the cervix by through a abdominal laparotomy approach. This is how the vaginopexy is performed. A needle is passed from the vagina and up to the hip, and then here a button is applied to fix the vagina at the place, and subsequently adhesions do form and the vagina remains fixed and does not prolapse again and again. This is one report which used a rubber anchorage for performing the vaginopexy, and this is how you can see the procedure was performed. This was passed through the hip, and through the hip this was again passed, and finally the rubber anchorage, you can see here how this was performed. Then vaginal prolapse in bitches. Vaginal prolapse commonly occurs in female dogs that have not been spayed. In vaginal prolapse, the swollen protruding vaginal tissue resembles what's often called a donut-shaped mass. While the primary cause of vaginal prolapse is estrogen stimulation, other causes include vaginal hyperplasia and genetic predisposition. Other causes of prolapse are prolonged straining resulting from a difficult labor and delivery or an interruption during coitus and mating. While the condition affects a range of dogs, breeds most commonly affected include Labrador and Bay Retriever, English Bulldog, German Shepherd, Saint Bernard, Mastiff, Springer Spaniel, and Weimaraner. When serious vaginal prolapse may prevent urination, the condition is almost always diagnosed just before or during estrus. While the outcome is positive for most animals, the chance of the condition reoccurring throughout pregnancy or at the delivery is quite possible. Because breeding may place the dog at further risk for the condition, spaying the animal may be recommended. Unless the vaginal prolapse is blocking the urethra completely so that the dog cannot urinate, the condition is not a medical emergency. If the bitch is unable to pass urine, she will likely require hospitalization, surgery to remove the blockage, and enable an assessment of the prolapsed tissue, and if required, a urinary catheter can be placed. Spaying is often suggested. In these pictures, you can see the prolapse vagina in a bitch. Again, this one in a bitch. This is vaginal hyperplasia, and this again is a prolapse in a bitch. To some extent, some homeopathic medicines like Sepia 200 or Arkham Lampa 200 potency administered orally 10 to 20 drops thrice a day have shown some promise in cattle and in dogs also to prevent the reoccurrence of the prolapse. But due to inconsistent results, they can not largely be recommended, or they may be tried, but the results cannot be guaranteed. Now we talk of another condition, the prolapse of the uterus, also known as casting of the calf bed. It's more in confined cows and buffaloes with little exercise. The incidence varies from 6 to 14%. Calcium deficiency predisposes to uterine prolapse. Dystocia handling and forced extraction of a fetus can lead to uterine prolapse. A constant sitting posture and the loose genitals is another cause. The replacement should be done under epidural anesthesia after washing and applying pressure inwardly taking care not to rupture the cotyledons. In bitches, replacement is done under general anesthesia. In long-standing cases with gangrene, hysterectomy is suggested. The risk factors for uterine prolapse include prepartum vaginal prolapse, a dystocia, a low serum calcium. The etiology of uterine prolapse. Decreased myometrial tone is a logical predisposing mechanism for the occurrence of uterine prolapse in cows. Unlike a vaginal prolapse, the heritability or additive individual susceptibility with subsequent pregnancies is not apparent in cattle with uterine prolapse. Vaginal tears or fistula can result in uterine prolapse in buffaloes as a result of strong contractions. The prolapse of uterus can be easily diagnosed by the visual observation of the everted radent mass and exposed placentomes. Uterine prolapse is an emergency and unattended cases may turn fatal. For easy replacement, uterine prolapse cases must be attended to with priority because of rapid development of edema, contamination, mucosal trauma, and cervical closure may render the replacement difficult. Moreover, severe hemorrhage may occur from the exposed placentomes, which when coupled with septicemia may prove fatal. The mortality rates in large studies in cows varied from 20 to 25%. So the prognosis always depends on the promptness of the replacement of the uterine prolapse. The therapy is manual replacement. The organ should be washed with water and saline or 1:1000 or 1:10,000 potassium permanganate. Application of sugar or salt solutions or alcohol to reduce the edema may be done. The organ is lifted upwards for easy passage of the urine, and any tears that are visible must be sutured with chromic catgut. The forequarters of the animal must be lowered, and manually the uterus should be gently everted starting at the base and continuing up to the apex is suggested. Vulvar sutures or post replacement oxytocin is suggested. Uterine prolapse in a mare is a medical emergency and is often fatal as a result of complications such as peritonitis following uterine laceration, uterine artery rupture, or systemic shock. Mares of all types, from draft breeds to ponies, appear susceptible to uterine prolapse. Manual replacement under epidural anesthesia using bupivacaine is suggested. Here you can see the uterine prolapse of a gravid uterine horn in a buffalo. This is a prolapse occurring postpartum in a goat, and then this is a buffalo which had a prolapse, and then because of the uterine tear the intestines have prolapsed out. This is a medical emergency. This animal should be immediately reverted to laparotomy, and the uterine part must be sutured. This is a buffalo having showing uterine prolapse, the cotyledons. These are the cotyledons, and this is the cervix. Again, this is how a prolapse retainer or the truss is applied in a buffalo to prevent the recurrence of the prolapse. In these pictures, you can see the prolapse of uterus in a sheep, prolapse of uterus in a sow. This is a prolapse of uterus in a sheep, and prolapse of the intestines through a uterine rupture in a sheep. Again, this is a cow having prolapse. The cotyledons are visible, and this is the cervix, and this is how the prolapse is replaced back. And this is a very severe form of uterine prolapse in which the blackening of the tissue has occurred and gangrene has set in. Such type of cases necessitate hysterectomy, and the prognosis is always poor. Prolapse of uterus can occur in a camel. this is the uterus of a camel which has prolapsed out from the cervix, and this is how it was manually replaced. So thank you very much. Kindly share the video and subscribe to my YouTube channel, Govind Narayan Purohit, if you like them. Thank you. Have a nice day.